Alright, so in this video, I'm going to be inserting a catheter on a male patient. I'm sorry it's late. Just got the catheter kit from Lindy and them. I'm going to be moving my camera a little bit. That way you can see me opening the sterile field. But I'll also say this is not what you do. I just want you to be able to see everything, and I don't have anyone recording me. So I apologize about that. So to begin, you want to make sure that you're gelling in. You want to go in and introduce yourself to your patient. You want to make sure that they can clarify their date of birth and their first and last name. So I'm going to say, hello, Mr. Claus. My name is Peyton James. I'm going to be your student nurse today, and I'm going to be inserting your catheter. Is that okay? And then he would say yes. So then I'm going to drape him for privacy. In normal terms, you would be draping the whole thing, but if I do that, the banana might fall off because it's taped down, so I'm sorry. So I'm just going to do it like this, but it should be draped, and just think of it as it is. Okay, you want to make sure there's good lighting, temperature's good, and that they feel comfortable with what you're doing. So at this point, you're going to apply your gloves. And then now I'm going to inject lidocaine from to the inside of the urethra. Act like I'm doing it. And then you want to get it all over the banana, penis. You want to rub, go underneath the shaft, make sure it's covered so it can get numb. Okay, so there's that. And at this point, I'm going to remove my gloves, and I'm going to open my catheter kit. So I have my sterile field around the catheter kit. I'm going to move it just that way you can see it, but you wouldn't do that. You would either put it at the head of the bed to make it easier, or you would put it toward the end of the patient by the legs. So I'm going to move it. You wouldn't normally do this because you don't want to break the sterile field. Okay, so I don't know if you can see it. I hope you can. I'm sorry if you can't. I'm gonna kind of get out of the way a little bit. That way you can see it. So you want to remove the cover with one finger. That way you're not breaking sterile field. And you always want to make sure you're open away from the patient. I know in that instance I didn't really do that because I'm just running out of room. I'm sorry, but you want to make sure you open away from the patient. And then you don't want to reach over the sterile field, which it's kind of hard because I'm running out of room. I'm sorry, but don't reach over the sterile field. Okay, so now at this point, I'm going to put the protective cover or the waterproof pad underneath the patient. But you want to make sure to not touch all over it and all that because, which I'll just do it again for you that way. Don't break sterile field. So it's hard not to touch it that much, but you just want to make sure your hands aren't all over it so you don't break sterile procedure. And you'll just put this underneath the patient without touching it so much. Okay, so now that is over the patient. I hope you can see that. I'm sorry if you can't. So you want to open the pack of gloves, which is the next step, and this is a sterile procedure as well. You're going to pick it up like this, and you want to make sure to not touch it as well because you don't want to break sterile field, which none of this is supposed to touch the patient or anything like that. So I'm sorry, I'm kind of breaking out so I don't mess this up. All right, so I'm opening the sterile gloves like this with one finger. It's not supposed to be off the sterile field of the packaging, okay? So then at this point, you want to make sure to apply the first glove on the dominant hand, which I'm going to do, if I can get this without it all going over there. So apply on the dominant hand, touch only the inside of the glove. So that's what I'm gonna do right here. So I'll pick it up like this. My less dominant hand and put it in my most dominant hand, just like that, without touching the outside of the glove. And then I'm going to go over to my less dominant hand, and I'm going to do the exact same thing without touching the outside of the glove. And you can fix it if you want, so I just want to show an example of how I have it on. Okay. Okay, so still the sterile filled. So at this point, you can also drape this over your client if you would like to. Which also remember, this is a sterile procedure as well. Okay, so the next thing I'm going to do is open the kit. It's already, I've got my filled open, all of that. So I want to take everything out of the box, make sure it's on the sterile filled, it's not touching anything, it's not touching the table, not touching the bed, it's on the sterile filled. Okay, so I'm going to take the specimen bottle out, and you want to slightly open that. That way it's easy to open if you need it. And then these are the swab sticks you would use with iodine. And then the lubricant. And then you also have your tube thing to insert on it. The syringe, sorry. So at this point, you want to make sure you want to take the catheter out of the box. Make sure it does not touch the table, does not touch the bed. Okay. And in this instance, you want to try to inflate the balloon to make sure it's working. They say they don't do that now, which I was like trying to do some reading on it, so they don't do it. But in the video, it shows to do it, so I'm just going to practice. I'm going to take that off. Which it doesn't want to go on there. Okay, you'd practice inflating it. I'm just going to say it's inflating because it has stuff in it, so I don't want to mess it up. So after this, what you're going to do is clean the penis, make sure it's all clean down there so there's no risk of infection or anything like that. So make sure this does not touch anything. You want to use cotton balls, and you want to start to the top of the urethra. You're going to use 3 cotton balls. So you're going to start from the top and work your way down and make sure it's clean. Clean around there. There's nothing on there. Okay, there's 1. There's 2. There's 3. You want to make sure you go in a circular motion. So now at that point, you've done it 3 times. That's done. So we're going to take the catheter. You want to make sure you have the tip of the catheter right here. I also forgot the step. You want to make sure you lube the tip of your catheter because that would not feel comfortable at all. Okay, so I have the catheter right here. Okay, and I want to have the tip with my less dominant hand, and I'm going to have this right here. You want to make sure you're not touching anything with this, and you're just inserting, you're not touching the patient, because if you touch the tip with anything else or the catheter touches you, that is not a sterile field. So at this point, you want to make sure to tell your patient what you're about to do. You want to make sure you tell them to take a deep breath, because that would not feel comfortable. So you're going to insert the catheter about 2 to 3 centimeters. And as you're doing that, you ask them to take a slow, deep breath, and then insert as they exhale. Exhale, sorry. Okay. And then you're gonna go farther till it reaches the Y. And then you're going to use the syringe, and you're going to inflate the balloon. Make sure, again, you're holding the catheter with your left hand, and then you're inserting the syringe with your right hand. So as you're doing that, you push it, you inflate the balloon, and you want to tug on it to make sure that it is not, it can't come out, it's good in there, all that. Because if it comes out, you have to restart the sterile procedure. So you want to make sure it's done like that. So after that, you want to pull in the cap gently like I already did. Okay, so I still have my hand on it, as you can see. And after that, you want to secure the tube. Sorry, I'm nervous if you can tell. So you want to secure the tube. I'm sorry, I moved my hand, I apologize. And then you want to hang the bag below the bladder, which it's hard to do on the stuffed animal. Sorry, my penis is falling. Lay that on there. I'm sorry, I'm trying to get it not to fall. Okay, you want to hang the bag below the bladder, and then you want to make sure that it's secured to the thigh first, and then hang it below the bladder. That way the flow comes out nice. And then after that, you're going to throw away all your trash. So you would remove this, rip it up, remove this to make sure this way it's all clean. And then you're gonna remove your sterile procedure, all of that stuff. This normally wouldn't be right here. Just wanna point that out. It'd be over here. So you would throw all that away in the trash. And that's how you do a Foley catheter insertion on a male. I'm sorry for the video.